Doesn't matter which vaccine you got when it comes time for boosters.
Yeah, Tony, all of our experts and research says it does matter, but they also went on to say, our experts did, new data on the effectiveness of the current vaccines continues to be strong, even in the face of the Delta variant. The dominance of the Delta variant across the country, combined with fears of waning immunity from the vaccines, has got a lot of people looking into and talking about booster doses. So let's verify. Does it matter which vaccine you got when it comes to getting a booster? Our sources are two vaccines experts, Dr. William Moss from Johns Hopkins University, Dr. Matthew Freeman from the University of Maryland School of Medicine, and the Food and Drug Administration. And all of our sources say, yes, it does matter.
So the only FDA-approved booster could be from Pfizer. None of the other vaccines can be approved by the FDA for boosters.
Those pharmaceutical companies have not submitted, the data, because they're still collecting it, on whether or not an additional dose is needed.
Regarding the Pfizer booster shots, an FDA panel did make a recommendation about boosters, but it wasn't universal.
Their recommendation is that these additional doses be considered for individuals older than 65 years of age, and individuals either at high risk of disease or high risk for exposure.
If you're wondering why the FDA panel wouldn't recommend boosters for all, both of our experts say the latest data shows the current vaccines still perform well.
The protective effectiveness of the vaccine against hospitalization and death still was above 90%.
Almost no one is going to the hospital who's been vaccinated and then infected.
So yes, in the case of boosters, it will matter which vaccine you originally received. But the data so far shows the vaccines still perform remarkably well despite the Delta variant. So what happens next for the other vaccines? Moderna and Johnson & Johnson are in the process of applying for full FDA approval for their vaccines. And then after that, that's when both companies say they've signaled that they will try to apply for booster approval as well. Tony?
All right, got it now. All right, thank you very much, Matt.